we're going to invite Raina Pang to present. Dr. Pang is is also at the University of Southern California. She received her bachelor's in psychology from the University of Oregon, PhD in neuroscience from USC, and there she's currently an assistant professor in the Department of Preventive Medicine. She's also the director of the USC Psychosocial Biology of Women's Health and Emotion Research Lab. Her research focuses on conditions that are disparately and specifically impacting women. The title of her talk today is Premenopausal Female Smokers with Elevated Premenstrual Symptoms Report Increased Positive Cigarette Effects. Her collaborators are Mariel Bello, a PhD student in clinical psychology at USC, Tyler Mason, who's an assistant professor there, and then Tori Eisenlohr-Maul, assistant professor of psychiatry and psychology at the University of Illinois at Chicago. So we invite Dr. Pang to present. We'll have Dr. Langer's presentation up shortly after this one. I think we got off track there with our slides. So just a reminder is Dr. Pang is joining us. We'll have time for our presentation, and then as she's presenting, if you want to submit questions through the UI there at the bottom of your screen, we'll present those at the end. So thanks, Dr. Pang, for joining us. It's so good to see you, and we'll do the handoff now.
And sorry for the wrong slide there. That was my fault. This is Kevin. Apologies. Thanks for joining us, Raina.
Yeah, thanks for having me. Okay, so my talk is Premenopausal Women Daily Smokers with Elevated Affective Premenstrual Symptoms. Let me make that small. Report Greater Positive Cigarette Effects. And I have my co-authors that were introduced, and then also I just wanted to acknowledge Matthew Snone. He's at the University of California, San Diego, and Madeline Leotode, who's at the City University of New York. These were actually project assistants and data specialists who helped with the coding of LifeData and actually collecting the data for this project. And they're now at grad school, so that's always good to hear. And then the research was supported by funding from NIDA, a KO1 award. So a lot of my research focuses on gender differences as well as women-specific factors in health and disease, with a strong emphasis on smoking. And the reason I'm really interested in smoking in women is that women compared to men have worse cessation outcomes. And some of the cessation outcomes might have to do with different efficacy of treatment. So we know, or there's evidence that nicotine patch, which is very commonly used, may actually be less effective for women than men. And we also know that women have increased smoking-related disease morbidity and mortality. So what you see with certain diseases related to smoking is that women who smoke may be more likely to die from these diseases than men who smoke. So COPD is one of these examples. And we also know that women have specific health complications from smoking. So women, there does seem to be an interaction of smoking and exogenous hormones potentially on cardiovascular disease risk. So for example, estrogen and smoking seems to really increase risk. That's why they don't recommend women smokers over a certain age to use certain birth controls. We also know that smoking during pregnancy has specific health risks for maternal and fetal outcomes. So these are the reasons why I think it's really important to study both gender differences in smoking as well as women-specific factors in smoking. And this talk is actually focused on a women-specific factor, which is premenstrual symptoms. And so premenstrual symptoms are symptoms with a phase-based onset. And there's a number of different symptoms, including affective, so increased depression, increased anxiety, mood lability, anger, as well as other symptoms. So loss of interest, concentration, lethargy, differences in appetite, sleep, as well as physical symptoms. And so a lot of these symptoms probably look very similar to other things, such as depressive disorders and depressive symptoms. So depression and major depressive disorder also includes loss of interest, difficulties with concentration, lethargy, changes in appetite, sleep. But what's kind of important about these symptoms is, again, this cyclical pattern of symptoms. And this is really what differentiates it from like other depressive symptoms as well as disorders. So this graph is showing affective premenstrual symptoms and at 3 different subphases of the menstrual cycle: the mid-luteal, the premenstrual, and postmenstrual. And what you see is this dark black line. Oh, sorry. The dark black line is showing you this distinct pattern where right before menstrual onset, you start to see this increase in symptoms, and then they subsequently resolve once menstruation occurs. And a lot of the research on premenstrual symptoms has kind of focused on within subject effects. So there's been a lot of focus on things like what happens to premenstrual symptoms if you abstain from smoking. And so we know that smoking abstinence increases premenstrual symptoms. There's a little bit of debate about this kind of correlation, mainly just because a lot of the symptoms of premenstrual symptoms also sort of overlap or do overlap with tobacco withdrawal symptoms, which I didn't show on the previous slide, but tobacco withdrawal also includes increases in negative affect, changes in, some physical symptoms and stuff. And then more recently, though, one of the things I was interested in looking at was how premenstrual symptoms within subject might be influencing transdermal nicotine patch efficacy. So as I mentioned, transdermal nicotine patch may be less effective in women compared to men. And there's also some evidence that the efficacy of the transdermal nicotine patch may vary across the menstrual cycle. And a lot of that research has focused more on menstrual cycle or hormonal effects, but I was actually interested to see if perhaps it was actually interacting with these premenstrual symptoms. And so what we found was that this was a laboratory task of smoking reinstatement, where participants after overnight abstinence are essentially choosing between earning more money or smoking. And half of the participants got a placebo patch at different phases of the menstrual cycle, and so it didn't have any nicotine, and then half got 21 milligrams of nicotine. And what we see is in the placebo patch condition, premenstrual symptoms didn't really influence how much cigarettes they smoked. And this might have to do with just the fact that withdrawal was so high that it might just be that they're smoking more. But what we do see in the nicotine patch condition is that women, when a woman is experiencing higher than usual premenstrual symptoms, they actually smoke significantly more than when they had low premenstrual symptoms. So I'm really interpreting this as that the nicotine patch may be actually less effective when premenstrual symptoms are higher than usual in women. But one thing I've been really, really interested in as well, which hasn't been studied as much, is really looking at more between subject effects of premenstrual symptoms. And so we know that the severity of premenstrual symptoms actually varies between women. And so some women actually experience no premenstrual symptoms or mild premenstrual symptoms. And this actually is the majority of women. They experience no to mild. But you do have this subset who experience either elevated premenstrual symptoms, where these symptoms may be causing distress, or alterations in function. And actually the DSM-5 now has premenstrual dysphoric disorder as a condition, a separate depressive disorder. And that, because it's a DSM-5 disorder, you need a certain amount of symptoms. But I'm really actually interested in, I think that similar to what we see with depressive symptoms, I really think that even the elevated premenstrual symptoms group may be at risk. So I kind of focus on more of that versus whether or not a certain number of symptoms are checked off. And again, I'm showing this graph again. I didn't mention this in the first round, but what you actually do see here is I talked about the black line. So those are the ones who are showing premenstrual symptoms, but you actually, again, do have this dotted gray line is showing women who are either having very mild or no premenstrual symptoms across the menstrual cycle. So I'm interested in looking at these kind of two different groups. And there has been less looking at this more kind of between subject factor, but there has been one study that found that during a cessation attempt, women with greater variability in premenstrual symptoms between phases were actually more likely to relapse. And I also conducted a cross-sectional report, which just looked at retrospectively reported changes in premenstrual symptoms. And that actually associated with increased retrospectively reported withdrawal during past quit attempts, which is some preliminary evidence that women perhaps who experience greater cyclical changes in premenstrual symptoms may be more susceptible to tobacco withdrawal or greater tobacco abstinence effects. So with this study, with that preliminary evidence, I'm actually really interested in understanding kind of motivational processes and how that might differ for women with elevated affective premenstrual symptoms. And so for this study, I was really interested in looking at cigarette effects. And so my first question was really just to look at whether women with elevated affective premenstrual symptoms report greater positive cigarette effects. And I hypothesized that they would report greater positive cigarette effects. I also was interested to see whether or not this association differed between the first cigarette of the day and other cigarettes. So in smokers, daily smokers with a naturalistic smoking pattern, the first cigarette of the day is usually the longest period of time of naturalistic tobacco abstinence. So I hypothesized that the effects of affective premenstrual symptoms on positive cigarette effects would be greater for the first cigarette of the day because they might be experiencing greater withdrawal, so that cigarette might be more reinforcing versus other cigarettes. And so we had participants, they had a baseline screening session assessing eligibility, baseline measures, we measured demographics. We also measured baseline depression symptoms using this as D, which I controlled for in all models because I wanted to look at the specific cyclical changes and not just if this is another marker for increased depressive symptoms, as well as cigarette dependence. They then completed 35 days of ecological momentary assessment. And following the first cigarette of the day and at random prompts, they answered these 3 questions. Green are positive cigarette effects. So these are pleasurable, was the last cigarette pleasurable? Negative affect relief, did the last cigarette relieve unwanted feelings or symptoms? And then there was one negative cigarette effect, which was worse, which is did the last cigarette make you feel worse? And at the end of every day, they also reported on whether or not they started their they had menstrual onset, and they also reported their affective premenstrual symptoms. And one of the things that's really important with premenstrual symptoms is the cyclical pattern can actually be hard to retrospectively assess. And there's a lot of evidence that it needs to actually be prospectively assessed because there's cultural reasons why certain people may have different reporting styles. So one of the advantages of having this EMA study is we could actually get these prospective assessments. And what we did is compared the premenstrual, so affective premenstrual symptoms. This is -1 is 1 day before menstrual onset, -7 is 7 days before menstrual onset, to post-menstrual. When you're talking about the menstrual cycle, day 1 is always menstrual onset. And so we used the window of 4 to 10 days post-menstrual onset to compare. And our elevated premenstrual symptom group had to have 30% premenstrual increases in affective premenstrual symptoms compared to the postmenstrual phase. And so our participants were premenopausal women daily smokers. They had to smoke at least 8 cigarettes a day, have a normal menstrual cycle of 24 to 35 days, couldn't be on hormonal birth control, and they had to own a smartphone for the EMA surveys. And we had 78 who had data on affective premenstrual symptoms for both premenstrual and postmenstrual, which was essential for determining the change. And 16 of those had elevated premenstrual symptoms, which is about 20%, which is actually almost lines up with a lot of the epidemiological data. And they didn't really differ on most basic characteristics, except for the women with elevated premenstrual symptoms were slightly younger. And what we found was that women with elevated premenstrual symptoms reported overall greater negative affect relief. You can see pleasurable, they also, so they're the light gray, they also had elevated, it didn't quite meet statistical significance, but they had clearly higher negative affect relief and really no difference in the one negative cigarette effect. And we did actually find a significant interaction for both of our positive cigarette effects. And it was actually in a different direction than we hypothesized. What we actually found was that in the low premenstrual symptom group, you actually see a significant decrease between the first cigarette of the day and other cigarettes for pleasurable, and no significant difference in the elevated premenstrual symptom groups. But as you can see here, they just are kind of remaining high. They start higher and they just remain higher, and it doesn't really decline. And similar to negative affect relief, although not quite as different, you do see the elevated premenstruals, you do see a little bit of a decline in how much relief they're getting. And interestingly worse, again, no real difference at all between first cigarette, other cigarette, as well as the premenstrual symptom groups. And so the conclusions from this are that women with elevated affective premenstrual symptoms report greater negative affect relief from cigarettes, and they also might be experiencing smaller declines in positive cigarette effects between the first cigarette of the day and other cigarettes. And really, what I think is interesting is, again, it looks like they're high and they're kind of just staying high, and all of the cigarettes are just possibly very reinforcing. And so that's interesting to me because increased positive effects may result in greater smoking behavior and a harder time quitting smoking. And really, I think this is an important group to be looking at for smoking, because I think they might have a harder time quitting. And that's my talk. So, and here's my contact information.
Okay, thank you so much, Raina, for that presentation. We've got a few questions starting to come in. Let me begin with this one. It says, great talk. You show the positive cigarette effects pre and post menses onset differed. Did early and late luteal phases also differ in positive cigarette effects?
Yeah, so actually, this actually wasn't showing menstrual versus non-menstrual. This was actually looking at women who have greater differences between the premenstrual and the postmenstrual. But I wanted to look at that too, because it is possible. So this is really looking at the between person effects. It is possible and likely and also very interesting about within subject effects. So when premenstrual symptoms, which I haven't shown and I haven't looked at, but I'm interested in, is when within subject premenstrual symptoms are higher than usual, do they experience more positive, or do they report more positive cigarette effects? And then it would also be interesting to look at if those are phase specific. Is it only, are they only associated, for example, during premenstrual or postmenstrual phase? And that's something that hasn't really been able to be teased apart in a lot of the menstrual cycle and smoking literature, whether the effects like any phase specific effects actually differ between the phases, if that makes sense.
Mm-hmm.
So I
Yeah.
don't have anything specific to answer
Okay.
that.
Another question here. Do you have any theories as to the physiological connection between high premenstrual symptoms and cigarette effects?
The physiological
Mm-hmm.
between high premenstrual symptoms and cigarette effects?
Yes.
Um, so I don't have any evidence for that exactly. And I don't know a lot about, I mean, we know there are physiological changes across the menstrual cycle. I mean, a very easy one to talk about is, I mean, there's very clear temperature changes in women across the menstrual cycle. I don't know as much. I think there's also been some documented changes in things like heart rate variability. I don't know as much of that literature, and it is definitely possible that some of those changes could be driving some of these effects, but I don't know anything specific. Most of it has focused a lot on hormones, which we very clearly change across, and how that might relate to changes as well.
Mm-hmm. Okay, thank you. Another question that crossed my mind as you were presenting, you shared, if I understood right, the some of the challenges with more retrospective assessments of premenstrual symptoms. Have others used EMA, and what are some of the unique insights, perhaps, that come out of those more intensive longitudinal assessments over time as it relates to those symptoms?
Yeah, so a lot of the research, so I kind of showed that graph where the pre versus post menstrual, and a lot of that research it wasn't used necessarily with EMA, so but they've been using daily diary surveys
Mm-hmm.
for to kind of make these prospective, and that's actually the gold standard. And people who do PMDD research, essentially, if you don't use that gold standard, like it's not really taken seriously. And but so it's been a lot of daily diary surveys, but I'm really interested in, and I'm sure there's other people too, kind of combining the EMA, because with the EMA, you're already getting, it's very easy to get the daily diary, but then you can also get these other momentary things that could also be of interest. I mean, for smoking, like I was saying, the first cigarette versus another cigarette is very important. And that's why it's essentially EMA. You can kind of combine the daily diary to get your prospective, and then you can look at more fine-tuned, you know, things, variables of interest that might vary, you know, either across a day or across the cycle phases as well.
Yeah, great. Yeah, that's something that we've wrestled with in our research at times, trying to capture sometimes a particular event that might be missed with EMA. And in your study in particular, I was fascinated by that question about the first cigarette. Related to that, how did participants do? Were they actually going in and completing like a user initiated session to provide that data?
Yeah, so how we set this up, and just so everyone knows, this study was started in about 2015. So LifeData is actually, you guys have come up with a lot of more features since then. So we had a user initiated survey where they logged each of their cigarettes, and then we had, for the cigarette logs, it was first cigarette of the day versus any other. And the first cigarette of the day, then they always just completed that. And then we also had them do a user initiated survey. I just smoked, and we trained them to only do that following the first cigarette of the day. And, you know, one of the downsides of that was, I mean, we did train them, but there was some cleaning that needed to be done. Sometimes people seem to fill out the I just smoked before versus, you know, at other times.
Okay, great, thank you. Another question that came up, have you looked at within-person, done any within-person analyses using multi-level modeling with any of this data?
Within person,
Mm-hmm.
like factors? Yeah, so I have done, so we had a different study. It was more at the day level, but it was looking at within person kind of negative affect, positive affect, and how that influenced like cigarette effects as well, things like that. But that was more at the day level
Sure.
for the first cigarette of the day, yeah.
Yeah. And any, like time lapse analysis to see how things are, those initial assessments, how they're maybe playing out in terms of later cigarette smoking and their experience with positive and negative affect?
So I haven't done anything like that yet with time lapse. One of the challenges with smoking, again, similar to what Matt Kirkpatrick just mentioned, is we don't pay people to do their cigarette logs. We just really encourage them, mainly because if you start to put an incentive there, it's unclear if they're just saying they're smoking a cigarette or if they're actually smoking more to try and get more money. And so one of the problems is some people it's really hard to get them to do accurate cigarette logs versus not. So, I mean, I think that's a challenge, and I've had lots of conversations with other colleagues, and it's just like a hard thing to figure out how you get people to do surveys without compensating them directly for it. But if it's a behavior, how you don't tie it to them either just lying and saying they're doing that behavior or doing that behavior more, right? And this study, obviously, I think some studies you actually do want them to do the behavior more, so it makes sense to compensate them. But with smoking, obviously, you don't want to essentially pay them to. I mean, you're paying them to log it more, but
Yeah, so those unintended consequences for sure.
Yeah.
Great. Great.
Oh, but I should say that those women do, if you just look at overall smoking, they do smoke more on average based off of our data.
Great. Well, I'm not seeing any more questions here, Raina. So I want to thank you again for a really fascinating talk and wish you and the lab well as you continue pursuing this work. We'll go ahead and start to transition to the next presenter. Just to help people kind of get a sense of where we're at in terms of the program. Next, we're going to have Dr. Shelby Langer presenting. She'll give her presentation. We'll have a couple minutes interaction with Kevin before our final presentation. And so we're making our way through the program and really appreciate the questions that have been coming through and the interaction. And again, as Kevin mentioned, you can go to connect.lifedatacorp.com to continue the conversation offline.